Prior to Spravato, the primary oral antidepressants were the monoamines. So they worked on serotonin, norepinephrine, and dopamine. Spravato is the first nasal antidepressant that works on the glutamate pathways, which work with other brain chemicals to help balance well-being and help with those depressive symptoms. With Spravato, you have to take an oral antidepressant. So you're using that combination treatment where the oral antidepressant will work on the serotonin, norepinephrine, and the dopamine. The Spravato works on the glutamate pathways. So that combined effect of the oral antidepressant and Spravato give you that synergistic approach to treating depression. Spravato can benefit patients who may have had difficulty metabolizing oral antidepressants or have a genetic predisposition where these medications just aren't effective for them. Spravato bypasses what we call the second pass, where medications are taken orally and then they have to be broken down. Spravato goes directly into the bloodstream through the nasal passages. Unlike oral antidepressants, the side effects for Spravato usually are gone during that 2-hour monitoring period. So the patients are in the treatment center, they receive Spravato. If they have some of the side effects, which will be dissociation, some high blood pressure, some sedation, those are almost always resolved by the end of that 2-hour monitoring period. The research showed that weight gain was observed in patients that were receiving the placebo as well. So if there was weight gain, it was from the oral antidepressant, not the Spravato. And sexual dysfunction was seen in less than 2% of patients in the study, so very low. Spravato is different than oral antidepressants that worked on the monoamines, serotonin, norepinephrine, and dopamine. Spravato works on the glutamate pathways. Glutamate is the most abundant neurotransmitter in the brain. That is where they feel the effectiveness is coming in for people who didn't have an adequate response to two or more oral antidepressants. So in a long-term maintenance of effect study, patients who stayed on Spravato were less likely to experience a return of symptoms, or they're in remission, compared to those who stopped therapy. Patients go through two major phases. The first is the induction phase, where patients receive the medication twice a week for 4 weeks, and then once a week for 4 weeks. And then at the end of that 8 weeks, we look at their symptom management. And we compare it to the initial assessment that we do in the very beginning to where they are at the end of that 8 weeks. And then the treatment plan is tailored to every patient individually based off of their symptoms. The goal is, if the patient is doing well at the end of those 8 weeks, we'll continue once a week for maybe another month or 2 months. And then if they're still doing well, then we say, let's go every other week. And then we do that for a couple months. And if they're still doing well, we say, let's go every 3 weeks. The goal in maintenance treatment is to spread the treatments out as far as we can while still maintaining effective symptom management. I have patients who are on maintenance doses of every 4 months, every 6 months. And I have patients who have stopped treatment, who felt that they no longer needed treatment. And it's a really good feeling, because at the end of it, they said, if I ever need you, I'll come back and see you again. But for most of those who are doing well, who stopped treatment, they have not come back. So in the same study that I referenced before, most patients in the study showed that within 24 hours, patients received significant improvement. The study followed them over that 8-week time period. The most significant change in their what we call the MADRS score, which is an assessment that the provider uses to rate the severity of the depression. Most of the changes occurred within a 24-hour time period and slowly went down throughout that 8 weeks. So patients can see positive changes within 24 hours and then a gradual improvement over time. But again, everyone's reaction is a little bit different to treatment, where some see significant improvement in 1 week, and others, it may take 2-3 months before they see improvement. I always tell them, be cautiously optimistic. They'll continue with treatment and not to compare themselves to others, because everybody is different when it comes to improvement.